Thank you, Madam President. I wanted to talk today about not just how Republicans are making healthcare more expensive, but also how they are making it just plain worse for seniors. President Trump came into office saying he would not cut Medicare, but that was clearly a lie because right now his administration is trying to privatize Medicare, in part by putting AI between Medicare beneficiaries and their health care. In January of this year, under Secretary Kennedy's and Dr. Oz's leadership, CMS began this pilot program that uses AI to require prior reauthorization in traditional Medicare for the first time ever. And it's set to run for 6 years. They call it the Wasteful and Inappropriate Service Reduction Model. Well, they got the wasteful and inappropriate part right. The wiser model uses AI to deny vulnerable seniors the care they need and that their doctors recommend. Not only that, but the for-profit contractors that conduct this prior authorization are paid a percentage of the cost of care that they deny. They are literally incentivized to rip health care away from seniors because that is better for their bottom line. When your business model relies on denials, denials are what seniors are going to get, and that is perverse. Wiser was rolled out in the beginning of this year in my home state of Washington and 5 other states without safeguards and without any transparency, and without the best interest of Medicare beneficiaries at the heart of this program. President Trump is saying, forget the doctors who went to medical school and took an oath to do no harm. AI knows better when it comes to healthcare decisions for our seniors. The consequences of that poor judgment are real and they are life-threatening. I hear from Medicare patients in Washington state all the time. They're suffering debilitating pain for weeks because they are not getting the care they need thanks to this harmful model. Patients like Joanne, she's a Medicare beneficiary from Quilcene, Washington. She went to her doctor for severe pain. An MRI showed that a herniated disc was pressing on her sciatic nerve. Joanne's doctor prescribed an epidural injection to help ease that pain. This was standard, routine care that before this year she would have been able to get quickly after it had been recommended by her doctor. But because of this wiser model, she had to wait 6 weeks to get approval. That means, thanks to Wiser, Joanne had to deal with unnecessary, unrelated pain for 6 weeks. Because of this nonsense delay, her day-to-day life was disrupted, and the burden fell on her then to fight for the care she needed. This is simply outrageous. But that is also Wiser working by design, and that is a direct impact of the Trump administration's actions. We have seen way too many stories, like Joanne's, from states that have been selected for this pilot program. No way should an algorithm decide if seniors should get the care that they need. That is exactly why I joined my colleagues here in introducing a resolution to overturn this model. And I want all of my colleagues to join me in voting for it so we can make sure seniors in my state and all over the country can once again receive their health care on time without interruption. Let's just use our common sense. It is clear as day that some AI models should never be at the wheel making health care decisions left and right. And it is not just patients I have heard from. I have met with healthcare providers all over my state. Whether it's a rural hospital or a doctor in Seattle, no one has had anything good to tell me about prior authorization in traditional Medicare. Now, I ran for office because I believe regular people deserve a say in how their government is run. And that is especially true when it comes to the government deploying AI technology. I don't know any senior Republican or Democrat who asked President Trump to let AI decide if their doctor recommended treatment was necessary. Of course AI can help make things more efficient or do good things. That's not what the Wiser model is doing. So let's get to the crux of it. As a country, we make a promise to American seniors. If they paid their taxes throughout their careers, they earned their Medicare coverage, full stop. Wiser breaks that promise to seniors with these senseless, AI-driven prior authorizations that deny and delay care. Let me be clear, many seniors choose traditional Medicare over other options because traditional Medicare rarely requires prior authorizations. People choose traditional Medicare because they want to make their health care decisions with their doctor, not with a private company that's out to make a profit. Simply put, the wiser model, which again delays and denies necessary care to Medicare patients, it is reckless and it is irresponsible. I want my Republican colleagues to join us in voting to get rid of Wiser once and for all, because, Madam President, this should not be a partisan issue. We all have seniors in our states that deserve the highest level of care without having to deal with red tape and delay. Thanks to Trump, AI is getting in between our seniors and their health care in Arizona, in New Jersey, in Ohio, in Oklahoma, in Texas, and in my state of Washington. We have an opportunity to stop this harmful experimental pilot program before more seniors are harmed. No senior in America should have to appeal their pain and suffering to a machine. To my colleagues, if it was your spouse or parent who needed care, who would you want to decide if they get their treatment? Their doctor or a for-profit algorithm? Would you want them to suffer in pain for weeks for care that they are entitled to? I know what my answer is. Let's maintain the promise of Medicare. Let's pass this resolution. Thank you, Madam President. I yield the floor.
Madam President.
Senator from Oregon.
Before she leaves the floor, let me say to Senator Murray that I so appreciate your presentation, and particularly talking about the algorithms. And also the fact is that under what you described and did very clearly, the big winner under this flawed experiment is a bunch of middlemen who are trying to profit off denials and not the people who really desperately need care. So I very much appreciate it, and Oregon is proud to be a partner with Washington State in leading the country to get rid of this very flawed idea, and I thank you for your remarks.
Senator Patty Murray delivered a powerful and emotional speech on the Senate floor about the Trump administration's new Wiser AI model, a pilot program that uses artificial intelligence to require prior authorization in traditional Medicare for the first time. Murray explained that the program, rolled out in 6 states including her home state of Washington, puts for-profit contractors in charge of approving or denying care. These contractors are literally paid a percentage of the cost of care they deny, creating a direct financial incentive to rip healthcare away from seniors. She shared the heartbreaking story of Joanne from Quilcene, Washington. Joanne's doctor recommended an epidural injection for a herniated disc pressing on her sciatic nerve. Before this year, she would have gotten it quickly. Because of Wiser, she had to wait 6 weeks in unnecessary, debilitating pain. Murray called it exactly what it is: simply outrageous. She pointed out that this breaks the fundamental promise of Medicare, that seniors who paid into the system their whole lives should be able to get the care their doctors recommend without fighting an algorithm or a profit-driven contractor. Murray introduced a resolution to overturn the Wiser model and urged her colleagues on both sides of the aisle to support it, making it clear this shouldn't be a partisan issue. No senior should have to appeal their pain and suffering to a machine.